who I will introduce is Professor Ping Liang, whose presentation is the application of contrast-enhanced ultrasound in interventional ultrasound. Professor Liang is chairman of the Department of Interventional Ultrasound of the Chinese PLA General Hospital. She is chief physician, tutor of doctors, and a recipient of the National Science Fund for Distinguished Young Scholars, and is a designated chairman of Ultrasonic Committee of the Chinese Medical Association. Please, Professor, carry on.
Dear Professor Paul Pseudo, colleagues, ladies and gentlemen, first of all, please allow me, on behalf of the Chairman of Chinese Medical Ultrasound Association, Professor Jiang Yuxin, to express our gratitude to EFSUMB. Thanks, Professor Paul Pseudo, the president of EFSUMB, provides this opportunity to enhance the academic exchange between the European doctor and the Chinese doctor. I'm Dr. Liang from Department of Interventional Ultrasound, Chinese PLA General Hospital, Beijing, China. Today, I would like to deliver the applications of contrast-enhanced ultrasound in tumor ablation. As we all know, the contrast-enhanced ultrasound have been used in most countries in the world for more than 20 years. Until now, at least 6 breeds of contrast agents have been approved by clinical applications. In China, the most common use is the Sonovil. It's the only foreign brand of the contrast agent approved by Chinese CFDA. Sonovil started to use in China from 2003. And this column showed the number of hospitals use the Sonovil in China. We can see the number using Sonovil increased year by year and reached to 1,400 hospitals in 2017 year. And this pie chart shows the published scientific papers in Sonovil field from 2015 and 2017. The Chinese doctor devoted a lot. They published about 80 scientific papers using Sonovil in recent 3 years, accounting for a quarter of total number of international papers. And also the contrast-enhanced ultrasound in thermal ablation was firstly applied to liver tumor in 2003, and it has been extended to other organs tumor, such as kidney, spleen, thyroid, breast, and pyrothyroid. It has the contrast-enhanced ultrasound has a high value in the thermal ablation. Before ablation, it can locate the tumor boundary, the size of the tumor, viable tumor area, and to detect the feeding artery. During the ablation, it can guide to target the conspicuous tumor and also detect the immediate complications to help the patient make decision. And after ablation, contrast enhanced used to assess the therapeutic effect and used to follow up in short time and long time. This table showed the published literatures regarding applications of contrast-enhanced ultrasound before ablation. Dr. Chen Minhua from China reported that use of the CEUS to find the tumor size and the numbers. And the similar reported The similar papers were reported since that. First, I would like to show some typical cases. First, to confirm the tumor number. For this patient with a history of HCC, MRI showed the multiple HCC nodules in the liver. However, from conventional ultrasound, it only can detect one lesion. So here, use the contrast-enhanced ultrasound, we can find the multi-lesions, multi-satellite lesions in the liver, which has good correspondence to the contrast MRI imaging. Second, to detect the feeding artery. This patient with HCC lesion in segmental 5, in the arterial phase, we can see the feeding artery of HCC clearly. I will show again. The feeding artery is here. For this patient, target the feeding artery first. It can reduce the heat sink and improve the thermal efficiency before ablation. The second, to confirm the viable tumor. For this patient, from conventional ultrasound, it's not so clear the boundary of the tumor. Use the contrast ultrasound, we can find the tumor here and the viable tumor at the periphery of the tumor. For this patient, we can make decision, how to make decision, use the contrast-enhanced ultrasound. And this table showed the published literature regarding application of contrast-enhanced during the thermal ablation. The contrast-enhanced ultrasound merely used to detect of HCC tinier lesion and visualize the target lesion and also find the immediately complications. This is an example from conventional ultrasound. It cannot detect the clear nodule. However, use the contrast-enhanced ultrasound, we can find the lesion clearly. So for this patient, we use the contrast-enhanced ultrasound to guide the target of the tumor and can target the tumor precisely. Second, to detect the residual tumor. This is an example. The patient received the thermal ablation for a benign thyroid tumor. The most of lesions showed the no enhancement, while a small parts here, the small parts of hyper-enhancement were detected immediately after thermal ablations here. So additional ablation were necessary for this patient. After additional ablation, the lesion was completely destroyed, complete necrosis. So here, this is a repeat. Use the contrast-enhanced ultrasound to evaluate the therapeutic effect immediately. And the third, to find and locate the bleeding and locate the bleeding vessel. This is an example. The old man received a microwave ablation for multiple liver metastases and complained of severe abdominal pain 2 hours after microwave ablation. From conventional ultrasound, we can detect the free liquid around the liver and the liver kidney fossa. Use the contrast ultrasound, we can detect the bleeding vessels here along the puncture antenna here. So it's the free liquid. And also use the contrast ultrasound, we can see the microbubble in the liver and the kidney fossas here. It's bleeding area. For this patient, we use the thermobeam injected to the bleeding site. This is a procedure. We puncture the bleeding area and injected the thermobeam here. And after thermobeam injection, repeat the contrast ultrasound reveal that there's non-enhancement in this area and also hepatorenal recess. That means complete anti-bleeding. And this table showed the published literature regarding application of contrast ultrasound after thermal ablation. In this period, from this table, we can see the Chinese doctor contribute a lot. The CEUS merely used to evaluate the therapeutic effect, including to confirm the ablative margin and evaluate the successful rate. This is an example. This patient received the microwave ablation for large adrenal metastasis. The maximum tumor reached to 10.7 centimeter in maximum diameter. After ablation from conventional ultrasound, we cannot detect the viable tumor area. Maybe the ablated area envelope all the tumor. However, use the contrast ultrasound, we can see here a small hyperechoic enhancement area about 2.8 times 1.7 centimeter. For this area, additional treatment when necessary. We can get the complete necrosis. And also in the long-term follow-up, we can use the contrast ultrasound to evaluate whether the tumor can get the complete necrosis. And this is an example. It's a renal carcinomas. Before ablation, we can see it's a very large size of the renal carcinomas in the upper pore of the right kidney. For this patient, it's a very large size of the tumor. And we performed the microwave ablation for curative therapy. And 6 months after ablation, the contrast enhanced confirmed complete necrosis for this lesion. And this is another example. Is an old female patient with a parathyroid adenoma. Before the ablation, contrast enhanced ultrasound showed the inhomogeneous hyper enhancement in arterial phase. It's here, very large size of the parathyroid adenoma. The maximum diameter reached to 4.8 centimeter. 2 days for this patient, 2 days after ablation, contrast enhanced showed non-enhancement in ablated area. And also we can find the tumor shrank in size. That means complete necrosis in this patient. However, 4 months later, after ablation, the increase of blood PTH and calcium level, contrast enhanced ultrasound showed the hyperechoic area. We can see the hyper enhancement area in the dorsal part of ablation. So for this patient, repeat ablation were given, and the hormone level returned to the normal level. So we can use the CEUS to find the local recurrence sensitivity. And also, this is another example. The ultrasound showed the ablation zone enlarged in the long-term follow-up. For this patient, received the microwave ablation for RCC 5 years, and use the contrast ultrasound. We can see the enlarged the ablation zone, and also in the arterial phase, there's enhancement in this ablated area. That means local tumor progression. And also, we can use the three-dimensional ultrasound to assess ablation. This is an example. The CT scan showed the enhancement area in the ablated, in the edge of the ablated area, indicate the cancer residue. And also we use the three-dimensional contrast ultrasound, find the residual areas here, which have a good correspondence. So for this patient, we can use the contrast ultrasound guide to target this area of the tumor and get the complete necrosis. In conclusion, contrast ultrasound plays an important role in the tumor ablation. It covers the whole ablation process, including pre, intra, and post-ablation. And also, it is superior to other imaging evaluating ablation margin and detecting complications immediately after using of ultrasound-guided thermal ablation. And also, it is an option to the patient unsuitable to CT or MRI contrast agents due to the renal dysfunction or allergy. And I believe the contrast agents will play more and more important role in the clinical diagnosis and treatment. This is my presentation. Thank you for your attention.
Hello there. Thanks very much, Professor Liang. I have no questions online for you at the moment, other than a greeting from Laura from the Children's Hospital of Philadelphia, who is online listening. Can I just say that also, just an observation, you do wonderful work with many different organs. We also do the same sort of thing, but we still rely on CT, and we still also rely on fusion imaging to target some of the lesions. Do you use fusion imaging at all?
Yes, in our department, we also use the fusion imaging, like CT scan, but only for the very difficult cases, including we cannot detect from the ultrasound, especially the contrast ultrasound. Otherwise, we prefer to use the ultrasound guidance.
Yeah, I would agree with you. Of course, I would, and
because a lot of those radiation. Yeah, I agree with you.
But the fact is that using ultrasound in this manner is so much easier for the operator, for the patient, and it's also much quicker to get your answer.
Yes. And no X-ray. And also for the thyroid and the breast, I think the ultrasound guided is much better than CT or MRI guidance.
Yeah. And the patient is with you, and you can talk to them all the time, which is important. Thank you very much, Professor Liang.
Thank you. Thank you.